What is your earliest memory of brushing your teeth? That's a random question, right? Okay. What about who taught you how to brush your teeth and how to take care of your mouth? Another maybe random question. How long did they teach you to brush your teeth? How long, how often do you brush your teeth? How often do you rinse and irrigate and floss? Who taught you how to do that? Well, today we have our favorite holistic dentist in the classroom, Dr. Claire Stagg. And today we're going to be talking about how to improve or tips on improving your oral hygiene or making it even better, optimal, or increasing whatever you've been doing in the past. Because I'm telling you, it's in the mouth. The mouth is the window to your body. And so today we're going to be learning a lot of things that you probably didn't know you didn't know. And so get your pen and get your pencils and your paper because we're going to learn and grow together.
And when you need a friend, you can count on me. I'll be right here waiting for you.
Hi, my name is Lillian McDermott, and I am a certified life coach, a certified holistic cancer coach, and the host of the Lillian McDermott radio show Classroom. If this is the first time you're tuning into the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening and viewing friend, will feel empowered to embrace inner truth and live the life of your dreams. Well, as I said, the mouth whisperer is in the classroom, and I am just so excited because she has stepped outside her comfort zone, outside of her allopathic training, into becoming a whole dentist. And this is the product of many years of her lessons and gifts, and she's sharing it with us. Smile, it's all connected. And since it is our sole purpose in life to give and receive love and knowledge, I am so grateful that Dr. Claire Stagg is here to do just that. Welcome back to the classroom. I missed talking to you.
Hi, Lily. I missed you too.
Yeah, I missed my last appointment, but I missed my last appointment, but I had reasons for it. As you know, my father had passed away, and so I feel like I need my Dr. Claire fix. So let's talk a little bit about this. And so thank you so much for coming in today and sharing your wisdom. But I know that before you created this book, there was a tiny little book that came out of you too. Do you want to share a little bit about the book and why you wrote it?
Right. So the book Lily's referencing to is called Captain IFBI. And interestingly, Lily, is that Smile started over a decade ago. And it was in 2018. I just had this urge to put this little tyke out. And so what happened is that was my in the islands we call it a lanyap or a little interval thing. So I actually had this one created, layouted, artistically drawn out, and published before Smile got published, at least 3 or 4 years before. It was a good diversion. And every time I talk about it, I cry. So let's not try not to
Well, you
cry
know
too
what?
much today.
It's always good to cry. Well, you don't know if you're going to see a tear or so, but what
Right.
brings that emotion? What brings that emotion to you that it makes you want to cry when you think of this baby that came out of you in that form of a book?
So what it is, it's the emotional context. Yes, it has to do with, how to maintain oral hygiene, and we'll get more into the details of that. But one of the things is that as a mother and being a professional, I didn't get the opportunity to talk about guilt things here, right? I didn't get the opportunity to spend as much time as I would have liked with my children. And my time that was precious with them was story time. So the actual name of the book is Captain IFEI Storytime. And you'll see that that's the name on the top, on the beginning. And so this is very powerful because people think, it's just about flossing, brushing, and when and how to do it. But in actuality, I wanted to bring that universality of the world back to center, in the sense that we're all one. It's all the same earth. It's all the same children, no matter what country they belong to.
Mhm.
They all have teeth. They hopefully all have families, and God willing, they're all brought up with love and light. So the universality was the earth with a big smile, and their countries, and they're about 10 different countries. Well, I forgot how many now. It's been a while, but every single step of the protocol has a child, male or female, demonstrating that particular part in their cultural dress, and or with parts of the decor that are specific to their country, religion, race, creed, or environment in general. So it was a way of bringing in geography and love and unity and the family dynamics, because at one stage you may have a mother, at one stage you may have a father, and it depends again which, and it could have been a little boy patient, or it could have been a little girl child, but it was always the family unit per se. And it's only at the very end do you have both parents. And this is why I get very emotional, because I wanted to put the US in the story also. And what happened is, everybody thinks the Eiffel Tower for France, but the Statue of Liberty for the United States. But with the theme of love and culture and the beginnings of all time, the biggest thing that you would imagine when you think of the United States are the American Indians. And so at the very end, we have an American Indian child with both parents, and you have on the wall, you have Chief with a fire with his little trainer, young not squaw, but the little Indian boy that's learning from the elders. And so there's a passing on of history and culture and tradition. There you go. So
Wow.
there's a lot more in it than just teeth.
Brush your teeth, irrigate, floss, all those things. And so
Right.
how wonderful that you were able to turn that into a story time with your children, and
Right.
that you would be able to share it now with the world.
Right.
So let's talk about that. Let's talk about, when we are like, when my grandchildren now come over, because I remember when my children, I taught them how to brush your teeth. We didn't have water picks back then, or didn't have electric toothbrushes, and if they were not very good. But let's talk about the basics, and when we should start training a child in brushing their teeth. Because I remember when Brittany just had little gums, there were like a little thing that they told me that I needed to brush her gums with. So let's talk
Right.
about at the beginning. Let's talk from the very beginning, the genesis
Okay,
of it
so
all.
from the very beginning, so always make sure before you get pregnant that you detox and you have a healthy body, because whatever you do to prepare the womb is in actuality what's going to help the gestation of the baby, right?
Mhm.
Okay, and then also what you eat is think of it, you're like farming or tilling the soil. You're getting that body, that little body that's growing inside of you. The ossification of the tooth buds actually starts in vitro, well, in vivo, I should say. Sorry, in vitro is the other one in the tube. So in vivo, you're actually creating the teeth already. So you might be starting the tooth buds of the primary teeth in vivo. All right. And that's why it's so important to make sure that you have nutritious apposition, that you're feeding your body the right things. So primary teeth, depending on the culture and or the patients, you could actually start having them as early as 4, 5, 6 months, sometimes even later. And there's usually, if you go by quarter of the mouth at each time, you have a central, a lateral, a canine, and 2 baby molars. So that's 5 plus 5 plus 5 plus 5. That's 20. So when the kids come in, you will count, you know, their fingers and their toes, and we kind of help them count their teeth too. That distracts them. So in effect, when you start, I would even start cleaning their mouths. Sometimes you can use a wet wash rag. Sometimes there's a little slip on, like a little rubber glove, just a single rubber glove, and it has little itsy bitsy little, they're like little, not bristles, but they're tiny.
Like
They're
little
like teeny,
tentacles,
teeny,
yeah, like little
right, like little
bristles.
barnacles, right?
Yeah.
And then you could take it and you could rub their gums, but you could also brush their teeth. Now, I got bitten once so bad by my firstborn. But I had to take my finger out and walk away because I was in so much pain. But she didn't know. She just thought it was fun, you know,
Yeah,
until
of
I was like
course. Isn't it
crying.
fun to always make mom just cringe and cry?
Right, right. So you can start with that, and then you have different appositions. So xylitol is a really good thing that you could start giving xylitol toothpaste. You can have xylitol rinses. You can have I actually found a company at a conference I went to 2 weeks ago to where there's actual hydroxyapatite toothpaste without whey or milk. So you could actually start remineralizing the teeth, especially for those adults who have a lot of root sensitivity. So just putting it out there. I just got my order in, and they have the weirdest, funkiest things like cake batter. There's even a chocolate flavored one, strawberry. I mean, I got so much stuff for kiddos, believe it or not. And there's another company called Supermouth, and they are in California. It was an orthodontist who created them. And they also have a little fictional character with a movie and everything. I said, oh, we must have been thinking along the same lines at the same time. So what you can do is have the mechanical functional motion of brushing, so to speak. But remember, it's not always absolutely necessary to have an adjunct with paste or rinse, but they can be very helpful. So those are the things that are inside the mouth that you could be bringing to the mouth. But remember, the other thing that you're bringing to the mouth is nutrition. So if a child is eating the wrong thing, too much sugar, sodas, sticky candies, especially with Halloween coming up, things that are going to sit on the teeth, even bottled milk. So that's something that people don't realize. There's actually sugar in milk. And unfortunately, there are some parents who actually give their children sodas in bottles to go to sleep. It's like, whoa. So,
Sodas.
yeah,
I've heard of milk in the bottle when the baby goes to sleep. Yeah, I
yeah.
could not do that with my kids because I
I
knew
know,
better.
and juice. So you have different things that are put in. So you have to be careful of what's actually,
Soda.
it's the staying power. Remember that Venn diagram, nutrition, environment, host,
Mhm,
etc.
mhm.
Well, all that could make a perfect storm. So you want to make sure that the right thing is there. And so if you could, for whatever reason, I've always noticed that mothers who nurse never have that issue. All right. And usually it's the last thing you do at night is you breastfeed and then go to put the child down and then poof, that's it. So
Yeah.
usually not an issue, interestingly enough, right?
Yeah.
So okay, so basically you have the mechanical function of the whatever you're using to clean. And again, use a wash rag if you just have no teeth or gums, you know, and then you could use soft filaments. Whatever you do, the softer the better. All right. The reason being it's not hardness that counts, it's that wiggliness of the filaments that can get between the teeth. That's the best. One of the brushes I love, and the shape of the brush in Captain IFBI is actually that of one that I carry here at the office. It's called the Swedish Curaprox brush. It has 5,460 filaments on each one. I know how they count them, but they did. And so they have that, and it is the softest. It's like going through a car wash, you know, with the cloth things. That's how it feels. So I even use them as an adult. I have them. There's two versions of them, one for basic oral hygiene. There's a children's version too, but there's even an author one for those patients who have braces on there with a little channel for the brackets. It's really cool. So what you do to your teeth, what you do with your teeth is very important, and what you eat that you leave in your mouth is very important.
Okay, so what, that's the beginning. So as the teeth start coming in, at what point does a child need to go through the process of flossing and rinsing and irrigating and all of those things? How early should we train our children to start learning how to do it themselves?
I would say as soon as you have teeth, start.
Okay.
We may not get as ideal a result. That's why I think parent supervision is really important and helpful, which is what I was doing with my kiddos, is that I was in there with them and I showed them how to floss, and then you come up with games, you come up with characters, you come up with things that distract them and make it fun, because somewhere along the line they're going to need to take over and do it and not make it a chore. All
Yeah.
right. So I was at a conference once, and it was an appliance therapy, a little bit like what you're going through. And the child, mom had asked her to go ahead and to film the protocol that she went through at night before she went to bed.
Mhm.
And so she filmed herself doing the irrigation, the flossing, the brushing, the appliance therapy, where the sprays, the this, the this, the this, the this. Now, people can think that it can be a long time. Well, everybody's different. People have more teeth, some people have less teeth, some people need more work in certain areas, some people have bridges to where you need, floss threaders. Everybody's different. But the thing though is that the more you do something repetitively, is the quicker it will go, because you're better at it, correct? The thing though is to learn it the right way the first time. And that's where in Captain, what we do is we use, in order to demonstrate and create a proper oral hygiene protocol, what we use is a little disclosing solution. And what it does have that property of staining the teeth, or I should say staining the plaque. It stains the old plaque blue and the red plaque new. All right. I should say the new plaque red and the old plaque blue. So in effect, when patients come in and they go ahead and they say, I just brushed my teeth, they say, okay, let's go see. It's the same thing when you have a little kiddo in there. First of all, you got to make sure they don't swallow the disclosing solution. And these are sold in the stores too. But what you're trying to demonstrate is, where are you missing? And that's where it becomes fun for them. So for the first 2 weeks, they put the disclosing solution before they do their protocol, and then after they do their protocol. And rule of thumb is you irrigate, floss, brush, irrigate after each meal. Because after each time you go, for example, you wipe, right? It's the same exact thing. Every time you eat, you're going to end up having, I call them deposits, or it's the biofilm. Did we ever discuss biofilm? Do you remember that?
Yeah, we have, but please do it again.
Go
Please do it
ahead.
again. Yes.
All right. So think of a egg yolk. That's the bacteria, the egg yolk. And then the white around the egg, that's called the biofilm. All this is in Smile, by the way, the book. But the bacteria are protected. That egg yolk is protected in the mouth by the biofilm. And so when you think about it, that bacteria, he's happy. Nobody's going to get him because he's protected. But if you go ahead and you remove the biofilm, then the bacteria is exposed, and then it can be taken away. So the egg yolk is a really good demonstration, and the egg white, all right, of what's happening in your mouth. We can clean your teeth, but within seconds, the bacteria that are in your mouth, which are there naturally, we call them saprophyte bacteria, they colonize the mouth. They just do. That's just the way it is. It's when you have too many bugs that are taking over the environment in the mouth that then have the apposition or the calcium in your saliva that adheres to that egg yolk, to the white of the egg, if you will, and then it encases the bacteria yolk. So you have like a hard shell around the bad guys. that's when you end up having periodontal disease. I call those barnacles, right? Remember? So the
Yes.
whole idea is to not have that biofilm to the excessive amount that it'll create periodontal disease and or gingivitis, if you will.
Yes, it's so interesting. So the bacteria that is in the mouth, at what point, so when you're putting these, what did you call them? There's like it allows you to see where you need to brush. What did
The
you call it?
disclosing solutions.
Disclosing solution. As an adult, I mean, that would be good to see as well.
We do.
Okay.
Everybody gets trained on it. So every single hygiene patient that comes in, we demonstrate where they're missing. So the protocol is the first 2 weeks, you do it before and after you clean your teeth, right? So now you have an idea where the plaque in your mouth is lodging itself. Because some people, like I have certain teeth that are got a little bit of an angle to them. So you'll find that there'll be a lot more plaque in that little corner, right? You
Yeah.
think you're doing a good job, but invariably that's where you're missing. So
Interesting.
you do it before and after you floss and brush and irrigate, or IFBI.
Mhm.
And then the next 2 weeks, you irrigate, floss, brush, irrigate. So you do your protocol, then you check your work. So
Ah.
you check your work for the next 2 weeks, and then you can see what you're missing. So each time, if you're doing it at least 3 times a day, if you eat 3 times a day, or at least in the morning and at night, all right, for whatever reason you can't during the day. But if you do it, then you say, ooh, okay, I know I always miss there. So when I'm actually doing my work, I'm actually going to spend a little bit more time. So it's, for example, you know that you have furniture in the mouth, and certain areas always have a little bit more dust bunnies than others. So you're going to make sure you take the vacuum cleaner and you're going to go a little bit more. You're going to take it off the thing and you're going to hold it by hand and get in under get the dust bunnies. It's the same thing. You're just training your mind to have that repetitive motion to, okay, in that corner, I need to have my extender because I want to have more dust bunnies. It's the same concept.
What kind of brands can you use for that? I mean, what are good brands for that? Is it a discoloration? Is it a different color? What does it look
So
like?
the one that we have in the practice that I have to buy through a down supply company is called two-tone, because I like it because it has two different colors. And actually that's the one I use in the book because it says exactly that. It stains the old plaque blue, because I made a mistake one time, and in the previous version had it to where it stained the new plaque, the old plaque red and the new plaque blue, but it wasn't, it was the opposite. So
Oh
that, so
no.
for those of you who have the previous version of Captain IFBI, that will become a rarity because that had a nice typo in it. So found that out through the company. And when we did, we republished the Captain. So Captain is republished. You'll see new, and he'll have a flag that says 2024. So that's different. So now
You're
you'll have it.
so clever. You're so clever. And for those of you who have purchased Smile, page 63 has the Captain in the book. So either way, but you can get one for your children as well. Now, is that book, I know it sounded very educational and it sounded kind of adult-like, but this is a book that you as a parent read to your child, or is this a book that a child can read on its own?
Both.
Okay.
It's very simplistic, it's easy rhyming, and they're all from here. They're no AI. That didn't exist back then. And so it's just very simple. And actually, I have patients that tell me the older siblings read it to the younger ones. Isn't
Aw.
that cool?
Yeah.
Yeah,
So
I
you
thought that
said
was very cool.
you have the two-tone, and what else? You said you had two.
So you can go to the drugstore, and I think they sell the single tone, which is the red one, in tablets.
What's it
And
called? Oh, single tone. Okay.
single little tablets in the drugstores. Now what's interesting is in the olden days, like 30 something plus years ago, they used to sell us the little tablets too before they actually put them out there for the general public to purchase in the drugstores.
I remember,
Yeah.
yeah.
And they used to do that too in the schools. Remember when they were
Yep.
doing oral
Yep.
hygiene days? You had to
Yep.
and trunk it and then spit
Yeah.
it out, rinse it out,
We
and then
all
you
had
could.
pink teeth. We all had pink teeth. I remember that.
Correct. Yeah.
Yeah.
Yeah. Yeah. Yeah.
And it had
One
kind
of
of like a different taste to it too.
yeah.
It wasn't a taste that like was candy or anything. It was a different taste.
That's a good thing that you don't want to swallow that.
Yeah, exactly.
Another thing too, since we're talking about coloration, is it's a really good opportunity to look at what your tongue's doing. Because if your tongue is also red and blue, get yourself a tongue scraper. I
Oh,
don't think I have one here with me right now, unfortunately, but it looks like a little loop. And what it does is you take it back and forth on your tongue, and it's very yucky though. It's very gross
yeah, I
looking.
got,
Yeah,
yeah.
and then you clean your tongue. It's like there's a lot in Smile about the tongue has its own gymnastics, its own oral hygiene tools, its own this and that. It's got its own everything, its own exercises. But that would be very helpful because a lot of times the bacteria that are located inside the tongue papilla end up recolonizing the mouth. So if you're not very good, or if you have a lot of oral systemic diseases like thrush and things of that nature, always remember to get your tongue also.
Wow. Okay. So at what point do you do the tongue? Do you do it
A
before
part
you
of your
brush?
protocol. So I irrigate, floss, brush, irrigate, and what I do, it's a little bit messy, is that if I go ahead and I have my water pick and it's not too much and it's not on too high, I'll water pick my tongue. Sometimes I use my brush with my brush bristles, I'll do that. And if I'm really being serious, I'll take my tongue scraper. But usually I use my toothbrush, to be honest with you, if it's a soft brush.
Yeah. So not a hard brush, but you know, the tongue scrapers are pretty hard because I
Yes,
have
well
one
that,
made out of copper or
no, that's good.
yeah, and it's like it's like a U shape. It's U
Yes,
shaped like this. And so I
yes,
grab it by both ends and I start from the back of the tongue and I scrape it to the front part of the tongue. Um,
correct.
who are people, because a lot, I mean, I didn't grow up with a tongue scraper. I was introduced to a tongue scraper well into my adulthood. At what point should a child be introduced to a tongue scraper, or should they just use their toothbrush? Because I remember brushing my tongue.
Correct. You could use to brush your tongue. I don't think the child usually, I don't think a child will have the amount of deposits that an adult will have, because I mean a lot of the adults will have, alcohol or a lot of beverages that are probably going to have what we call volatile sulfuric compounds.
Mm,
That's where people have bad breath. We talked about bad breath too.
mm.
And then and or you have some medication, for example. You ever saw a black hairy tongue? That's pretty cool. Some medications will change the size of your papilla. So think of your papilla, the papilla, think of them as little toadstools. They're on your tongue, all right? And there's rows of them going that way, and there's rows of them going that way too. And there's different areas that have the salivary, the the nerve endings for sensorial perceptions of taste. So you have bitter, sweet, don't ask me where right now, I don't know. Bitter, sweet, acid, etc. They'll be positioned differently. It's in the book in Smile. I had a lot of fun writing all this down, but different positions will tell you exactly, partitioned off on the tongue exactly. So sometimes people have their taste buds that will be the papilla really will be modified by the medications that they're taken, simply by the structure of the tongue buds, as well as also their quality or their cleanliness. All right. Yeah, it can be
That
pretty gross.
Yeah, well, what about the like the film? You talked about the biofilm in the mouth, but in the tongue, sometimes I've been taught or I've been told that if you have like stringy mucus on the tongue or in the mouth, that could be like candida or some other too much of an overgrowth. Is that true?
So, so you have three different things there. One is mucus, and usually mucus will be a backflow
Or
from what's
saliva?
happening in
Yeah,
your
saliva.
nasal
Yeah.
passages and your sinuses, and that would be really bad when you're laying down and people think that they're drowning or they can't breathe right. It's because they're not breathing through their nose because they can't. So that's the first thing. The second thing is the you talked about the covering of the tongue. So that's where again I think you're going to sort of have to take it in two different places. It's different in a case by case. So
Mhm.
I have patients that come in, their tongues are pristine, they're pink, they're gorgeous, the papillas are like happy. You can literally feel them happy. And then you get those that come in and they're sickly and they're not doing well and they drink a lot and they drink a lot of coffee, things like that. Chinese medicine, you can diagnose up to 250 diseases. I mean, that was back when I was taught this, way back when. That's a lot of diseases, but just by poking your tongue out and look at it. Have you ever seen an acupuncturist?
Of course, I
Yeah.
have. Yeah.
Do they make you stick your tongue out?
Yes, but they've never done acupuncture on my tongue. Is that something that's
No,
possible?
no, I
Okay,
know
because
not on me either. No, but they make you stick your tongue out.
yes, yes,
So
they look at
Chinese
it.
medicine, it's the same thing. They actually use the tongue as an organ for diagnostics.
Isn't that
And
interesting?
so
But we
should
use
we,
the
by
ear, we use the ear, we use the eye, we use the foot. I
and the
mean,
hands
and the hands. Yes, there's so
and
many
the
different
eyes,
ways. Yes, the
right?
eyes. Yeah,
Right.
yeah.
And so we mentioned something about diagnostics. So do we, by the way, dentists. A lot of dentists do not realize the actual potential of diagnosing and looking at the tongue. So, for example, I know we're sidetracking from Captain, but if
Okay.
you're looking at the tongue and it's scalloped, that means something totally um, different for what us allopathic docs would be trained in the Western medicine, if you will. But in Chinese medicine, it means something totally different. And
Mm,
I'm not sure if it's wind or if it's heat or if it's whatever, but it means something specific, right? In our world, so for example, if you come in and I have a patient that has what we call a scalloped tongue, all right, usually it means that that patient's clenching and grinding and there's no room for that tongue, all right, and it's compressed and it's under suction. So the biggest thing would be to go ahead and to arch, expand, and make more room for the tongue. But it's a very good indicator too where it's being positioned at night, because usually you'll find, or during the day, because if it's scalloped, it means that it's sitting or it's low in the lower part of the mouth, or it's sitting down here, which
mm,
means it's not on top at the roof of the mouth where it should
mhm,
be at rest. So
mhm.
there's all these different things. Again, color, shape, dots, spots, sometimes red, geographic tongue. There's so many different things that we are trained in there, and cancers too, by the way. All
Mhm.
right, but not they're not being utilized, I think, as much as they could for what we really should and could be doing.
It sounds like like I said, they say the eyes are the windows to the soul, and the mouth is definitely the window to the body, because you could tell by looking into somebody's mouth, how they're doing. Not just necessarily the tongue, but their mouth. So now we've gone, let me just go back and say, okay, so let's go beyond childhood, or let's as a child, that you're teaching your child how to have good oral hygiene. How long should they brush? Do you brush up and down? Do you brush round and round? Do you, sideways? There's so many different ways. I learned how to brush sideways. So let's talk about the proper way of brushing.
So rule of thumb, remember, we want to get the tissues clean, right? So I always say before you go an extra pole to any sort of different varieties, I always say try to get red to white, red to white. The whole idea is to get that. I don't even have a toothbrush with me, would you believe?
That's
And
okay.
God knows we would think that we have. I usually have quite a few there, but there's the one that I wanted to show you. Okay, so let's go ahead and let's say, for example, let's use this. This would
Is
be
this your favorite brush? Oh, okay.
this is the Rotodent. I can go ahead and I can get another one. I have lots of little YouTube videos, by the way, on how to brush on my website. But so, for example, if you go ahead and you use this, tell me if you can see. I'm going to make it. You see how that goes down under my cuticle?
Yes.
All right. But this is also filament. This is super. I'm going to put it against my skin so you can see the contrast. See how soft this is?
Mhm.
All right. And that's the concept, is you want it to go ahead and splay into the between the teeth, not because invariably what's going to happen is if the teeth are shaped like that and you go like that, you miss that entire section.
Mm-hmm. Mm-hmm.
All right. And so if I go ahead and I have a brush, I go red to white. And so my filaments are going to go like there, and then whoosh, they go inside that little triangle too. All right. Now you can get a brush that's going to be super soft, and some people advocate little circles. Little circles are fine as long as it's not scrubbing. But then again, even with a Curaprox brush with a 5,460 filaments, you could go ahead and you could scrub. I said that's the only brush I will ever advocate you could scrub with, to be honest. All right. So the sides, you can do little circles, you could do red to white, whatever. The only time I say that you should scrub for sure is on the biting surfaces of the teeth. So if I go ahead and I have this, for example, I'm sorry, I wasn't prepared to talk about that. But if you have this, the biting surfaces of the teeth are where the actual grooves are. And that's when you want to get your brush and you want to literally scrub there for sure, for sure.
Very good, very good. So that's
So,
good. That's good for people because everybody has their own way that they were taught, but were we taught properly? And this is a great information for all of us to take note and say, you know what, we need to one up our game here because
right.
our mouth is so important. Our mouth is so
So,
important.
so this is what you were asking me earlier on. This is representing healthy. This represents unhealthy. And with the barnacles, with time, you end up having a lot of bone loss. See? So to the point where you end up losing the tooth. You with me?
Yep.
So this is, and this one is stuck in there, but I have others that they come off. So this is where you have full-fledged periodontal disease. This is what I call the barnacles. And then this is the healthy area. All right. So flossing now is like brushing between the teeth. People say, yeah, do I floss? That's a $1 million question, to floss or not to floss, right? So, people, companies come out with terms that say you'll never need to floss again if you get our water pick this or whatever, whatever. And I said, hello, no, 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 no. There is no mechanical action better than actually taking that little piece of Teflon coated string or Teflon string and going between your teeth and in a C motion. Why? Because what you're actually doing is you're going between the teeth. The floss, the water picking can only go so far. Yes, it'll jet, but it won't go between. There's a solid couple of millimeters between the tongue side and the cheek side. You actually need to mechanically rub whatever's in between away. So there's no ever substituting flossing with anything other than flossing.
So we talked about this one time, and you said absolutely flossing is necessary. I've had Hal Huggins, Dr. Thomas
Yes.
Levy's mentor, and he learned everything. And he was like, no flossing. Flossing is not necessary when you use water pick or when you use, especially if you use hydrogen peroxide, a little bit of hydrogen peroxide in the water. That there's no need for that because it could cause damage in the gums. What do you say about that?
All right, so we approached this last time, and I'll
Yep.
go ahead and I'll reiterate to debunk. So this is my personal opinion, okay? All right. So what's the goal? What's the goal of keeping your mouth clean?
Staying healthy.
All right, but what do you do to go ahead and to keep your mouth clean?
I brush, I irrigate,
Okay.
yeah.
All right. So the whole idea is if you're doing a good job, then you're going to remove all the deposits, right?
Mm-hmm.
But you're never going to be able to, with everything that we've just said within the few minutes or half hour that we've already talked, you're never going to remove everything.
Mm-hmm.
All right. I'm going to try to get a good analogy. You have a door. All right. You have a door frame, and there's 3 people trying to get through it. How many people can go through it at the same time?
It all depends how big they are.
Exactly, right? It's exactly the same thing with the teeth. All right. So depending on how much space you have is how much food is going to get entrapped. All right. Okay. So think of flossing as wedging those people through and getting them to go through the door. All right. Now, if you go ahead and you have a crappy, unhealthy mouth that you've never, ever, ever cleaned before, and that has a lot of bacteria, then I can understand where you can have that, oh my God, don't floss because now we're going to dislodge all the bacteria. The American Dental Association says for those who are prone to having heart disease, should be pre-medicated with antibiotics before a dental visit, before their cleanings. Why? Because when we actually go down under the gum line, we dislodge bacteria. This is true, but we're actually using a heck of a lot more force than actually flossing. So I can understand where somebody would say, don't floss, don't floss. You're going to dislodge bacteria, etc. But at the same token, how many more visits do those people spend at their dentist with bacteria? So it's 6 of one and half a dozen of the other. It's like, okay, what do you do? The goal is to make sure that everything's clean. The goal is to make sure that there's no bacteria, no people stuck in that door frame. You want to have that passageway clean and everybody can go through. All right. And that's what the floss does, is it goes ahead and dislodges everything so there's no issues stuck there.
No, I totally agree. Whenever I get something stuck in my teeth, I
Drives
definitely
you nuts, right?
floss. It does. It really does. Especially as I've gotten older, there's been some separation. We're working on that. There's some separation in my teeth, and my teeth have shifted a bit from grinding. And of course, this is why I have the TMJ orthotics, and the top one goes at night, because I want to make sure that my teeth stay as pristine as possible, as long as possible. I want to keep my teeth as long as possible. But the reality is that I didn't visit the dentist for the first time until I was 10. And I
Wow.
didn't have any cavities until I went to visit the dentist when I was 10. And so I was taught a great way, I mean, to be clean, but to think about it, I have exponentially changed the way that I, brush my teeth, floss, or irrigate, but what I thought was fascinating was that, you say you irrigate, floss, brush, and then irrigate again. So how much time do you spend taking care of your your mouth? How long does it take you? What's your oral routine time wise?
Right. So remember I told you I had that little kiddo who was taping everything.
Uh-huh.
And also it's a standard joke whenever my girlfriends call, it's like, wait, I gotta do teeth. So I gotta do my teeth because I don't want to be too tired to not do my protocol, right? So this is where if you go ahead and do what you're supposed to do often enough, it goes a lot faster.
Mhm.
Plus, you know where you're missing, so you can do those dust bunnies in the corners very easily, and you do a good job. One of the things that I found is when I irrigate first, it goes a lot faster afterwards because it gets the bulk of everything out. That's why I put irrigate first thing. Get the bulk of the food out. All right. Then I floss. Why? Because I'm actually going to use the floss in a C motion to get all the food that's stuck between the teeth that I missed with the irrigator. So I get all the plaque off. What I have found through the years is that even though Dr. I floss really well because I know what to do. I can see because I have this big magnifying glass that I look and I actually hold it and I floss, right? And I use the plackers, which is why I have two hands available.
I
What
was
I
gonna
have
say,
found,
if you're looking at the mirror and you're flossing, that's pretty remarkable.
right,
I'd be
right,
going like
right. So
this,
I
yeah.
use the plackers and I use the 2-string ones and the Teflon coated ones. So what one
Oh, you
string
do?
misses,
You put
yeah.
Teflon coated ones? You're
Mhm.
not concerned about the Teflon?
Never thought of it that way. I don't do wax one.
I
I
don't
don't
do
do
the
the
wax
wax
either.
one.
I don't need to do the wax either.
Right.
Yeah, I'm
But
just
But
wondering.
there's
Yeah,
a
okay.
brand called Glide. I would have to go and see what they actually do, because I don't know if
Yeah.
it's Teflon, like the bad Teflon. I
Well,
don't
we'll
know,
have to
but I
find
will look
out.
in.
To be
Yeah, I will.
continued, to be continued. And
To
this
be
is very
continued.
important. And before
Yes.
we, because I mean, we're already, look, I can't believe how much time has flown. I just want to encourage all of you to go to whenyouneedafriend.com. While you're there, please floss, irrigate, brush, and floss again and irrigate. But no, while you're there, please subscribe to the website. Then make sure that you like me on all social media. Do all the whatever you can to make sure that you support my sponsors like Dr. Claire Stagg. Make sure that you're supporting her the way that she's supporting the classroom as well. I want to encourage you also to go to my Shop Now bag. And these are all Lily approved products. And just make sure that you know that these are, some of them are affiliates that offer a small benefit to the classroom. So if you decide that you want some, it will help the classroom grow. As you know, costs have increased as censorship has increased. So we just want to make sure that all this information is shared, that you know what you need to do. So if you would like to use the Lily approved products, please go to that page. You can also become an enrolled student in the classroom, whether it's $1 or $1,000 a month or a one-time donation. That is so much appreciated, whether it's your time, your talent, your treasure. And I want to remind you that on October 1st, we changed the Rewiring the Brain with Neurofeedback. With Dr. John Silva, we changed it to October 1st due to an emergency, the death of my father. And Dr. Silva felt that it was needed for me to just take some time before stepping into another project, which I thought was so wonderful. So if you want to be a part of it, it's October 1st from 7 to 9 p.m. Eastern time. But don't worry if that time doesn't work for you, because it's going to be recorded, and everybody that will join and pays for the webinar, it's a worldwide webinar, will be able to have a copy of the video, and you can watch over and over. Whether you can attend or not attend, you will get the copy of the video, and you can ask your questions ahead of time so that the video, Dr. Silva can handle your questions. But rewiring the brain is so important, and with neurofeedback, and this is how you answer the question, why am I doing this? So why do we need to brush? Why do we need to irrigate, floss, brush, and irrigate again? So that's the question that we're answering today with Dr. Claire Stagg, and all her information is behind me. You can get a hold of them at 321-777-2797. You can say that again, 321-777-2797. That's 321-777-2797. I know you've memorized it by now. It's healthconnectionsdentistry.com. You can go to her website. I think you have a Facebook as well as YouTube channel, and lots of information there. And I just want to say thank you, Dr. Stagg, for everything you share here. I guess I need to know the amount of time. Just recently, my grandson said to me, Mimi, when I wash my hands, I sing happy birthday to you. And that's how I know that I've washed my hands long enough. What can you sing when you're brushing your teeth?
Well, I've heard that some, actually not heard, I know some of the electronic brushes have timers on them,
2 minutes,
and I
yeah.
never knew why they were stopping when I was using them.
30 seconds. That's
So you asked me. So how I do it is I irrigate, then I floss, and I actually started irrigating again because what I found is that the plaque rolls over on the floss. Then so
yes.
I irrigate, floss, then I irrigate again, and then I brush. And then brushing doesn't take very long at all anymore. All right. But
Ah.
I make sure that I use my xylitol paste, and then I check, make sure everything's
And
clean,
the
and then I
10x mirror or 20x mirror, yeah.
and then I go ahead, yeah. But you'd be surprised what we miss.
It
It's
it
really scary,
it is.
And then I love there's a unit that I found. When I go to these conferences, I gotta try stuff, because if it works, then that's when I'm gonna recommend to my patients. If it doesn't, I'm not. And I don't recommend anything that I actually don't use myself. There's a combo that I love called the Sonic Fusion, and I don't get anything from them, but it is Waterpik that created a sonic brush that has actual filaments. They're not hard bristles, and there's a little jet that comes through the brush itself. So you could take apart the brush, use the brush. All right, you could go around the house, and I like it because it's soft and it gets everywhere. And you could also use it but plugged in with a water, and it actually brushes away all the rest of the plaque.
I love
After
that.
I
I love
do
that.
love that too. And every time I use that, man, I feel like squeaky clean.
So are you using that as well as the rotodent that you have in your office, or have you stopped,
Correct, but I finished, so that's where I would brush, and then at the very end, I use the Sonic Fusion with the brush and the water, and
wow.
just takes everything out. So mind you, I have 2 sinks. So I have everything to irrigate, floss brush, irrigate with my water pick and my brush and my flossers. And then I'll go to the other sink where where the Sonic Fusion is. And that's my finish the night and put my appliance in, because so I don't clench and grind too. And then I go to bed. Yeah.
So how long
That's,
does it take you?
it could take anywhere from 5, maybe 10 minutes or less.
Mhm.
Depends. But
Yeah.
there's a lot more happy birthdays, especially if I've eaten things that, especially eating things that have seeds in them, or if I haven't been as good as I should have been during the day. Yeah, I pay extra special attention,
Especially at
because then,
night. At night when you go to bed, you're going to be in bed, your mouth is like all the bacteria are
right,
throwing the party and they're getting ready to kind of like whether
right.
you did a good job today or not a good job, they're going to infiltrate wherever they can.
So that's why I spend the longest time is at night. Because if there's
Yeah.
any time you spend the amount of time is at night. During the day, I'm happy if I get to floss. I'm happy if I get to brush. I mean, I have everything at the office. I have a water pick. I have everything here. In the car, I have my plackers. I have a bottle of water. I have my xylitol gum. So I'll get everything done. But at night, it's that sacred. That's why I said I don't want to have chats and then get too tired, because if I don't do the protocol, then I'm in trouble, because I feel so
That is
guilty.
so true. Before, like when Robert and I watch a movie before, like in the evening, and and I know that after that movie or whatever, I'm going to go to sleep. I go to bed with my teeth brushed, with my if I'm going to be laying down, I have my upper orthotic and
Yes,
laying,
good
or
job.
yes, I'm your teacher's pet. Although last week I wasn't very good at it because of being around so many people.
That's
With
all right.
yeah,
It's all
and
good.
I knew you would forgive me. But yes, it's so important that we set ourselves up for success. I know that if I want to go to the gym the next day, I take out my clothes the night before. If I want to have if I know that I want to have a good oral health routine, or if I want to develop something, I do it before I'm tired. Because once I'm
Right,
tired, that's not a time to continue to enhance whatever it is that you want to
right.
enhance. So, we're down to like maybe a couple of minutes left, Dr. Stagg. Is there anything that we didn't discuss today in the classroom? I mean, when you said you had more than an hour's worth of, for oral hygiene and habit, is there anything that we haven't discussed? I cannot believe that we were like almost done here. It's gone fast.
There's so many tools, and don't let anybody guilt trip themselves. Don't let anybody get freaked out that they don't have this, they don't have this, they don't have that. What you really need is to go ahead and to train yourself. And I say, get a big mirror, one of those mirrors that magnifies, and get the floss, and then work it, work it, work it, and then understand where you're missing. And I think that's it, is to get what works for you. And I mean, I've talked about 6 or 7 or 8 different tools, and I have
Yes, you have.
more. I have more at the office,
You
but
did say we could
everything
talk for
different,
over an hour with it. So,
different strokes for different folks.
correct.
Everything is different for different people. And what may work for you may not work for Tom, Dick, or Harry, or
Yeah.
Jane Doe. So, and it's the same thing. What works for me may not work for another. And you got to know your body and you got to know your level of tolerance. So I know some people, they aren't going to do it. So then I tell them, okay, if you do nothing else, do this. All right.
Yes.
And then there are others, they like their wine, they like their blueberries, they like their chocolate, they like their coffee. Oh my God, the staining is abominable. And so now we spend more time trying to remove stain than actually cleaning their teeth. So
Baking
it's like,
soda,
okay,
baking powder, is baking powder good for that?
so it depends. You have to be careful again, which baking powder. You have to be careful of which peroxide because you've got industrial grade,
Yeah.
and some things can be more toxic at a certain level of
Yeah.
acidity
Yeah.
or basicity. So you have to be careful what chemicals you're using. The most important thing, so for example, the rhododendron, they say you don't really need to use toothpaste. The more you use the brush and it froths white, that's the biofilm.
Oh, wow. Wow. And one last question before we go. People have been using these little picks that have like a little blue or green. And I heard, and maybe you can, tell me if this is true or not, that people's gums were getting, those blue little rubber pieces were getting trapped in people's gums because they were using
Wow.
it. Is that something that you suggest, or because I know you talked about the different kind of flosser, but what about the
Right.
picks?
So there's those are usually in our world they're called stimudents.
Yes. Uh-huh.
So that's the brand actually. So they're little long rubber pokey things that look like
Yes.
a Christmas tree.
Yes.
Toothpicks do the same thing.
Uh-huh.
So it all depends on what you're using. And of course, you don't want to use anything that's laced with arsenics. You know, some toothpicks may be. You never know. I don't know. All I'm saying is be very careful. But again, that some people have to use something a little bit bigger. In the stores or at the office, we have little interdental brushes. So it's a single tufted brush that goes in there. And again, it's in a shape. You can use them several times, just wash them in between.
Hmm.
You got to be a little bit creative and figure
Yeah.
out what it is that you need and what it is that you want to do and what is it you're really trying to accomplish.
Well, you were right. We had a long conversation about brushing and oral health, and this has been great. I'm going to go out and get some of the things that you suggested because this is great. This is great information, and I hope all of you take the time, share this video, share it with your friends, let people know that Dr. Claire Stagg is all about the smile and all about being connected. And get Captain IFBI.
He's on
IFBI.
Amazon.
Yes.
He's on Amazon too.
Awesome. Irrigate, floss, brush, and irrigate. Until we meet again. This is Lillian McDermott and Dr. Claire Stagg wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.